800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray from the Michigan Cosmetic Surgery Center and Skin Deep Spa at 719, we'll take a break. We'll come back. More of your questions. Lines open for you at 800-859-0WJR, 800-859-0957 as this special edition of The Big Story continues here on News Talk 760 WJR.
Post Plus is home to U of M. You're never far from a Southeast Michigan Ford dealer, and you'll always know where to find your local Ford dealer when you use your Southeast Michigan Ford dealer WJR map. Go to WJR.com now and click on the Find Your Way to Ford Fun Facts logo for more information on how you could win a $200 Visa card from your Southeast Michigan Ford dealers and News Talk 760 WJR. Welcome back to this special edition of The Big Story. Tonight, Lloyd's special guest, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Call WJR now with your cosmetic surgery questions for Dr. Gray at 800-859-0WJR. That's 800-859-0957. Once again, here's Lloyd Jackson.
And if you'd like more information on Dr. Gray, you can visit his website, anewyou.com, anewyou.com. And if you'd like to give him a call, because you'd like to make an appointment to get a consultation, 248-538-3333. 248-538-3333. Let's go to the phone lines at 800-859-0WJR, 800-859-0957, and talk to Stan, who's calling from the car. Stan, what's your question tonight?
Hi, Dr. Gray. Thank you for taking my question. My question is regarding the procedure through the belly button for breast enhancement.
Yes.
With your experience, we're concerned about doing a procedure like that, and with the mammograms and the breast cancer yearly check. Does that in any way affect the ability to detect any type of problems that may occur with breast cancer?
All right. There are 4 ways to place implants, either through the nipple, underneath the breast, into the armpit, or through the belly button. Now, people who seek out breast enlargement surgery have a lower incidence for breast cancer than the general population. Now, it's not because you receive breast implants. It's because people who seek out this procedure typically are small-chested, have less breast tissue, therefore have less risk. There are other techniques to view the breasts. One of them is called the displacement method or Eklund technique, where he pushes the implant back and draws the breast tissue over the implant and takes the picture. You can see more breast tissue when it's under the muscle, and you can see less breast tissue than you would see over the muscle, but it hasn't correlated with any increased risk in breast cancer. All right? Now, they take more pictures, and they're able to visualize your breasts, and there's millions upon millions and millions of women doing this throughout the world every year, and it's not causing health problems.
Thank you, Doctor.
You're welcome.
Stan, thank you for your question. 800-859-0WJR, 800-859-0957. Ruth's on the line from Westland. Ruth, good evening.
Hello. The tucks that you do for drooping eyelids,
yes.
Have you ever done any for medical purposes, like vision is being affected by these drooping eyelids as opposed to just the cosmetic reason?
Of course. When I do a procedure, it's whether your eyelid is being obstructed for you're doing it for obstruction of vision or you're doing it for cosmetic reasons. When I do the procedure, I take both into account. When you go to physicians that are ophthalmologists that do these procedures for vision, they just clear enough skin so you can see. They don't do it for cosmetic purposes.
I see.
And there's a different perspective. So if you just need enough skin removed so you can just see, then you go to your ophthalmologist.
I see.
If you want me to make it look good and so you can see, that's when you see a cosmetic surgeon.
I see.
You follow me?
That's very interesting. That really answers my question
There's
perfectly.
a difference in training, you know.
Oh, I see. You know, can I just ask one more question?
Sure, of course.
When you were discussing the breast cancer, that people with women with smaller breasts didn't have the risk that women with larger breasts.
Less risk.
Yeah, right. Sorry, yeah.
No problem.
I guess my point is Kate Jackson and a couple of other sin actresses seem to, develop cancer. And I was just kind of wondering, besides genetic, is there any other reason why that would be, since the risk is supposed to be lower?
Well, I don't know her family history, but cancers can run in families, and careful family history is very important. But we all know cancer can strike at anyone at any time, and even actresses and actors. So. And there are people too seeking out cosmetic surgery as well. So, when it occurs in an actress or an actor, it makes the news, but it occurs in everybody. So, it's not related to the surgery. It's just something that would have occurred anyway. It has nothing to do with the surgery.
I see. Well, that makes sense.
Okay.
Well, thank you very much for your answers, Doctor.
It was a pleasure. Thank you for calling.
Ruth, thank you for your call. 800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa, who is my special guest this evening on this special edition of The Big Story. Marcia is calling from West Bloomfield. Marcia.
Yes, thank you for taking my call. What I would like to know is I'm 70 years old. I'm in good shape. I weigh 104 pounds, and I'm only 5 feet tall, but I would like to have some body sculpting done, just a little, and my tummy tucked. How much does a procedure like that run approximately?
Well, it's very, I'm the doc. I don't usually quote things, so it's very difficult to do that. But, I applaud you because it has nothing to do with age. It has to do with you and how you're the same as you were when you were a young kid. The only thing that changes in everybody is your body is deteriorating. And, mine is, everybody's is at every moment. And, I'm sorry I can't answer your question with the cost because that's not something that I do. I'm the guy that performs the procedure, but it's not something that I go around quoting. But if you call my office, and we'll give you the number, it's 248-538-3333. They can give you a range. But certainly, without seeing you, I don't know that I would even recommend certain things. We'd have to go into consultation and see what really bothers you.
Okay, I will make an appointment then.
Okay.
Well, thank you for answering my question.
Thank you for calling.
And thank you for the call. Once again, that number, 248-538-3333. If you want to call Dr. Gray tomorrow morning, 248-538-3333. We're going to take a break and come right back with more of your calls. Lisa, Christy, Jim, stay on the line. We'll be right back with you. And we're going to head over to the WJR Big 7 Traffic Center and get a check on the roadways with Peggy Hop.
Welcome back to this special edition of The Big Story. Tonight, Lloyd's special guest, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Call WJR now with your cosmetic surgery questions for Dr. Gray at 800-859-0WJR. That's 800-859-0957. Once again, here's Lloyd Jackson.
Thank you, Mark Blackwell, and we're taking your calls at 800-859-0WJR, 800-859-0957. And if you'd like more information on Dr. Gray, you can go to his website, anewyou.com, anewyou.com. His office number is 248-538-3333, 248-538-3333. Let's go to the phone lines now. Go to Christy from Livonia, who has a question for Dr. Gray. Christy?
Hi, Dr. Gray. Thank you for taking my call.
You're welcome.
I would just like to ask more about your perfect lipo. I've been hearing a lot on the radio.
Yes. Actually, when people come in and complain about fat, okay, it's also sometimes they have a problem with skin. It could be loose, which means extra. It's dangling. Or they just want it tighter because around the corner it's going to get extra. People come in complaining of irregular, lumpy, bumpy cellulite, and also people complain of volume. The perfect lipo is a procedure that's designed to handle your specific complaints. If you have cellulite, but your complaint is just the volume, you don't have to pick procedures designed to treat the cellulite. You just go after the volume. And let's say you have complaints of fat and cellulite, then we can design a procedure that treats fat and cellulite for you. If your complaints are loose skin and fat, we have designed procedures to treat skin and fat, and we use a combination of different techniques. Ultrasonic lipo reduces volume. The laser reduces some volume, but more importantly, it is the refining tool. It smooths cellulite, helps tighten skin. Heat causes tissue to tighten. So we can also use thermage to tighten the skin, Fraxel that tightens skin. If you're concerned with stretch marks, Fraxel is one of the components of the stretch mark therapies that we offer. People can treat their cellulite with Dermosonic and Triactive, which helps smooth the fat afterwards. So the perfect lipo is the perfect procedure designed for you.
So you customize it for the patient.
Exactly. You got it.
Okay, and then how much reduction can I expect?
Well, if you can grab it, I can reduce it. So figure about 50 to 75% of whatever you can grab can go with the ultrasonic. And in the laser can take it somewhere between 50 to 90.
Okay, and now the recovery time, that's my other concern.
Since fat has no pain fibers in it, and the ultrasonic liquefies the fat, it feels like a Charlie horse or a pulled muscle. So there is no downtime. I have people on the treadmill that evening right after the procedure.
Oh, wow. So I could do something like on a Friday and be back to work totally fine on a Monday.
Yeah, or the next day.
Or the next day. Okay, perfect. Thank you so much. Do you do consultations?
Yes, we do.
Okay,
sometimes.
All right, thank you so much.
All right, Christy, thank you for your call. And if you like a consultation and talk with Dr. Gray, 248-538-3333 is his office number. Jim in Grand Rapids has a question for Dr. Gray. Good evening, Jim.
Yeah, good evening, Dr. Gray. How you doing?
Hi, Jim.
I got a question for you. My wife, we've been married quite a while. She's about 55 years old or so. She weighs right around 100 pounds. She's 5'3". But we had a couple of children years ago, and she's always had this little pouch on her belly. Would she be a good candidate, because she's always talked about it, to see you and get rid of that?
Yeah, she's a good candidate. I mean, the pouch can be a component of a couple of things. It could be just fat. It could be the muscle from the children. Now, muscle stretches, skin grows. But are you a meat lover? Do you eat steak?
No, I do, yeah, but she...
Do you ever eat grizzle?
No, well, I try and cut it out now.
Right,
yeah.
Exactly. Well, the grizzle is actually what is between your two muscles on your abdomen. And what happens to make room for the baby, it grows as well, just like skin. So it's like your jacket is much looser than you.
Sure.
So what happens is we tighten the muscles. So I'm not saying that your wife's problem is the muscle, but it could be. So that's where I would come in and explain to you what is going on and what procedure would be best.
Sure. Okay. Well, I think you've answered my question. We'll have to come down and see you.
Thank you.
Jim, thank you for your call. 800-859-0WJR, 800-859-0957. Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa is here in studio to take your calls. Let's go to Lisa from Detroit. And Lisa has a question for Dr. Gray. Good evening, Lisa.
Hi there, Doctor. How
Hi,
are
Lisa.
you?
Great.
Good. My question is about the mommy makeover that I've heard advertised.
Yes.